60 seconds, somewhere on this planet, another human brain loses blood flow. Another family gets a phone call they never expected. Another person who thought they were completely fine suddenly cannot move an arm, cannot speak, cannot recognize the people standing in front of them. And here's the frightening part. In many cases, the body tried to warn them first. Not with dramatic movie symptoms, not with collapse, not with screaming pain, but with small, strange episodes, brief moments, symptoms that disappear so quickly, most people ignore them. That is what makes stroke so dangerous. The warning often whispers before the disaster screams. If you want health information explained in plain language without fear tactics, false promises, or medical confusion, subscribe and tap like. Dr. John is working toward 500,000 subscribers, and every click genuinely helps this information reach more people who may need it before it is too late. I also post practical health checklists and short prevention guides on Telegram. The QR code is on screen. If you want quick references, you can save on your phone. Now listen carefully. Most people imagine stroke as something random. You were fine 1 second, then suddenly you were in an ambulance. But in reality, especially with ischemic stroke, the process usually started years earlier. Blood vessels slowly became inflamed. The inner lining became damaged. Plaques quietly grew larger. Blood became stickier. The arteries feeding the brain became narrower and less flexible. And then one day, the system finally failed. This matters because anything that develops slowly can often be detected early. And if it can be detected early, there's still a chance to stop it. When doctors say stroke, they are actually describing two completely different emergencies. The first is hemorrhagic stroke. That happens when a blood vessel bursts and bleeding spreads into the brain tissue. Pressure rises inside the skull, brain cells are crushed, and the situation can become fatal very quickly. The second, and much more common type, is ischemic stroke. That is when a blood vessel becomes blocked. No blood reaches part of the brain, and brain cells begin dying within minutes. About 85% of all strokes are ischemic. That is why this video focuses mainly on them. To understand why every second matters, you need to understand how demanding your brain really is. Your brain weighs only around 2% of your body weight. But despite being relatively small, it consumes about 20% of the oxygen you breathe and a huge share of your circulating glucose. It is active every second of the day, even while you sleep, even while sitting still, even while doing nothing. Your brain never truly powers down, which means it needs a constant, uninterrupted blood supply. The moment that supply drops, brain tissue begins entering survival mode. And unlike muscle or skin, brain cells are extremely poor at recovering once they die. That is why neurologists repeat the same phrase over and over. Time is brain. Every minute matters because every minute without blood flow means more permanent loss. Now here is the part many people never hear clearly enough. Before a major stroke happens, the brain often sends temporary warning attacks first. These are called transient ischemic attacks, or TIAs. Many people casually call them mini strokes, but that name is misleading because there is nothing small about them. A TIA is often the final warning before a much larger stroke. The symptoms may disappear, but the danger does not. Imagine one of the major arteries in your neck. Over years, cholesterol plaques form along the inner wall. The opening becomes narrower and rougher. Then one day, a small clot briefly blocks the already narrowed artery. For a short moment, part of the brain loses blood supply. You experience symptoms, then the clot shifts, or the artery relaxes, blood flow returns, and everything feels normal again. So you tell yourself, maybe I stood up too fast. Maybe I was tired. Maybe it was stress. But medically, that episode may have been your final warning window. Research consistently shows that the risk of a major stroke becomes especially high during the first 72 hours after a TIA. Not weeks later, not years later, sometimes within the next few hours. And the tragedy is that many people never seek help because the symptoms vanished before they reached the hospital. The brain basically said, I almost lost blood supply. And the person answered, I feel okay now. That mistake costs lives every single day. The warning episodes themselves are often short, sometimes only 30 seconds, sometimes 2 minutes, sometimes 10. That short duration is exactly why they are so easy to dismiss. But temporary symptoms do not mean temporary danger. In fact, temporary symptoms can be the strongest warning that a permanent stroke is approaching. So let us walk carefully through the major warning signs your brain may send before a catastrophic event. The first warning sign is temporary blindness in one eye. This symptom terrifies neurologists because of what it usually means underneath. A person may suddenly notice that vision in one eye becomes dark, gray, blurry, or covered by what feels like a curtain. Not both eyes, usually one. Some people describe it like smoke passing across the eye. Others say it feels as if someone switched off half the world for a few seconds. Then just as suddenly, vision returns. The dangerous mistake is assuming the eye itself was the problem. In many cases, the real issue is not the eye. It is the artery feeding the eye. That artery branches directly from the same carotid circulation that supplies the brain. A tiny clot or plaque fragment can briefly block blood flow to the retina. The retina is living nervous tissue. Without oxygen, it immediately stops functioning correctly, so vision disappears. When the blockage moves away, blood returns and sight comes back. That moment of recovered vision often creates false reassurance. But what many people do not realize is terrifyingly simple. The next clot may travel a few millimeters differently. Instead of temporarily affecting the eye, it may block a brain artery permanently. And suddenly the outcome is not blurred vision. It is paralysis, speech loss, permanent disability, or death. Doctors even have a classic name for this event, amaurosis fugax, fleeting blindness. In hospitals, that phrase is treated like an emergency warning siren, because neurologists know something the public often does not. A major stroke frequently arrives after several smaller, ignored warning episodes. The second warning sign is sudden numbness, or tingling on one side of the body. This is not the normal numbness from sleeping awkwardly on your arm. That type has a clear mechanical cause. A TIA-related numbness is different. It appears suddenly without posture explaining it. One side of the face may feel strange. One hand suddenly feels disconnected. One leg becomes heavy or rubbery. Some people describe pins and needles. Others describe loss of sensation or a floating feeling. The reason this symptom is usually one-sided is because each side of your brain controls the opposite side of your body. So if blood flow temporarily drops in one hemisphere, the opposite side begins malfunctioning. And again, the terrifying part is how quickly it may disappear. 5 minutes later, the person feels normal. But inside the blood vessels, the disease process is still active. The third warning sign is sudden loss of coordination. What many people casually call, "I suddenly walked like I was drunk." You may suddenly stagger sideways, miss a step on perfectly flat ground, feel violent dizziness for no clear reason, or your legs stop cooperating normally for several seconds. This often points toward temporary blood flow problems in the cerebellum, the balance and coordination center at the back of the brain. The cerebellum constantly calculates movement precision. It helps you stand upright, walk straight, maintain balance without consciously thinking about it. When blood flow there becomes unstable, movement suddenly becomes chaotic. This is why unexplained dizziness, combined with balance problems, should never automatically be brushed off as just vertigo or just tiredness, especially if it appears suddenly without an obvious trigger. The fourth warning sign involves speech, and this is where people often confuse normal memory slips with neurological emergencies. Forgetting a word occasionally is common. Stress, fatigue, distraction, and aging can all cause that. But TIA-related speech problems are different. The breakdown is abrupt, noticeable, disturbing. You may know exactly what you want to say, but your mouth cannot produce the words correctly. Speech becomes slurred, broken, slow, or worse. The words come out fluent, but completely incorrect. Some people suddenly speak nonsense sentences without realizing it. Others cannot understand what is being said to them, even though hearing is normal. These episodes occur because specialized language areas in the brain suddenly lose blood supply, and when those language centers malfunction, communication collapses almost instantly. If speech suddenly becomes abnormal, even briefly, it should never be ignored. Because speech problems are among the strongest classic indicators of disrupted brain circulation. The fifth warning sign surprises many people because it sounds unrelated at first. It involves autoimmune inflammation, skin changes like vitiligo, and unusual headaches. Vitiligo itself does not directly cause stroke, but it signals that the immune system has become capable of attacking the body's own tissues. And when autoimmune inflammation affects blood vessels, the inner lining of arteries, the endothelium, can become damaged. That endothelial layer is critically important. Think of it as the smooth protective coating inside every blood vessel. Healthy blood vessels are smooth and slippery. Blood flows cleanly through them, but damaged endothelial surfaces become rough and inflamed. And once that happens, cholesterol, platelets, and inflammatory material begin sticking more easily. Plaques start forming. Clots become more likely. Circulation becomes unstable. So when someone develops unusual severe headaches together with inflammatory or autoimmune signs, doctors often think carefully about vascular health rather than assuming it is just stress. And headaches themselves are complicated. Some headaches come from muscle tension, some from neck arthritis, some from nerve irritation, but sudden new headache patterns, especially alongside neurological symptoms, deserve proper evaluation. Now let us talk about one of the biggest misconceptions surrounding stroke. The myth: my cholesterol is normal, so my stroke risk is low. Unfortunately, vascular disease is far more complicated than one cholesterol number. Because stroke is not only about what floats in your bloodstream, it is also about the condition of the blood vessel walls themselves. And one of the biggest destroyers of those vessel walls is chronically elevated blood sugar. Even before full diabetes develops, high glucose quietly damages endothelial cells. The vessels become stiff, inflamed, less flexible. Microscopic injuries appear. Then cholesterol and inflammatory particles begin accumulating more aggressively inside those damaged areas. This means prediabetes is not harmless. A person can have slightly high sugar for years, while silent vascular injury keeps progressing. Smoking accelerates this process even further. Cigarette smoke exposes blood vessels to continuous chemical assault. Inflammation rises, blood becomes stickier, platelets clump more easily, clots form faster. This combination dramatically increases ischemic stroke risk. And then there is blood pressure, another area full of confusion. Chronic high blood pressure absolutely damages arteries over time. It weakens vessel walls and accelerates plaque buildup. But many ischemic strokes actually occur when blood pressure suddenly falls relative to a critically narrowed artery, especially during sleep. At night, blood pressure naturally drops. That is normal physiology. But if an artery is already severely narrowed, that nighttime drop may reduce flow below the minimum needed to keep brain tissue alive. That is one reason some people wake up already having a stroke. The process may have begun hours earlier while they slept. Age increases risk significantly, especially after 50, but stroke is absolutely not limited to elderly people. Thousands of strokes happen every year in adults under 45. In younger patients, doctors often investigate different causes, including clotting disorders, autoimmune diseases, congenital vessel abnormalities, trauma, and hidden heart rhythm problems. Which brings us to one of the most important hidden stroke causes of all: atrial fibrillation. Atrial fibrillation is an abnormal heart rhythm where the upper chambers of the heart quiver chaotically instead of beating normally. Blood begins swirling instead of flowing smoothly, and stagnant swirling blood forms clots very easily. Those clots can then travel directly into the brain circulation. Many people do not even realize they have atrial fibrillation. They only notice occasional fluttering, skipped beats, mild palpitations, or fatigue. That is why longer heart rhythm monitoring is often necessary, because a normal 20-second ECG may completely miss intermittent rhythm disturbances. Now here is the most important practical question. What should someone actually do if they experience one of these warning signs? First, do not panic, but do not dismiss it either. The goal is urgent evaluation, not denial. One important rule: do not drive yourself if you suspect a TIA or stroke. Losing coordination or vision while driving can become deadly within seconds. Another critical point: never start blood-thinning medications on your own without medical guidance. People hear that aspirin helps some strokes and assume taking it immediately is always safe. But hemorrhagic strokes involve bleeding, and blood thinners can worsen bleeding dramatically. Doctors use brain imaging, usually CT scans, to determine which type of stroke is happening. Without imaging, guessing is dangerous. If symptoms appear suddenly, emergency evaluation matters more than home remedies or internet advice. And even if symptoms disappear completely after a few minutes, that does not mean the danger passed. It may simply mean you were given a warning instead of a catastrophe. There are several evaluations doctors commonly consider after suspected TIAs. One is carotid duplex ultrasound, which examines blood flow through the neck arteries and checks for dangerous narrowing. Another is glycated hemoglobin, HbA1c, which reveals average blood sugar levels over roughly 3 months and helps detect hidden prediabetes or diabetes. And another is Holter ECG, monitoring to detect intermittent rhythm abnormalities, like atrial fibrillation. Stepping back from all the medical terminology, here is the bigger truth. Stroke is often the final chapter of years of silent blood vessel damage. But long before the final chapter arrives, the body frequently leaves clues. Temporary blindness, one-sided numbness, sudden balance problems, speech breakdown, new neurological symptoms that appear suddenly and disappear quickly. These are not symptoms to wait and see for. They are conversations your brain is trying to force you to have, and sometimes those conversations happen only once before permanent damage occurs. So after watching this, do one practical thing. If you have ever experienced symptoms like these, even months ago, write them down clearly. Do not trust memory. Write what happened, how long it lasted, which side of the body was involved, whether vision or speech changed. Then discuss it with a qualified doctor, because prevention works best before the emergency arrives. And in stroke medicine, timing changes everything. The earlier vessel disease is recognized, the more brain tissue can still be protected. And sometimes the difference between a normal future and permanent disability is simply whether somebody took those first warning signs seriously enough.